Welcome to the Dr. Frank and Steve podcast with your hosts, Dr. Frank Williams and Dr. Steve Snodgrass, MD, F.A.C.S., where we discuss a broad range of topics without limitations. Let's get to it. Here's Dr. Frank and Dr. Steve.
Hello, welcome back. This is Dr. Frank and Steve podcast. I'm your host, Frank Williams, and this is Dr. Steve Snodgrass, MD, F.A.C.S. We're going to be covering a topic that's pretty popular now, but we just want to go over it so everybody has some good information and know what it is, what it's about, and how it can affect you, because it's one of the biggest crazes going right now. So we're going to be covering the drug Ozempic, which is huge, and not just for diabetics, but also as a weight loss drug. As many of you can see commercials daily, evenings, about any time on streaming platforms, networks, television, during your favorite shows. So we're going to jump right into this topic, and then we'll give you the facts and also opinions on it. So let's get started, Steve.
Okay, thank you. Welcome. And I guess we're going to out ourselves here a bit because our hometown in Bowling Green, Kentucky, is the Ozempic capital of the United States. So we beat out New York, LA, Miami, all that. So party down.
Yeah.
What can you say? But the reason, people say well, why? Is there's been things like, oh, why a southern town is number one and all that sort of thing. But if you look at country ham, biscuits, gravy, bucket of chicken, all the fixins, little Ozempic for dessert.
Yeah, I had to get you there. And we're a vastly diverse community, as you know.
Yeah.
We have a federal relocation center here. It was put in during the Clinton era, and I mean, our population, we have like the second largest Bosnian population outside of St. Louis. So, and then we have a tremendously large African, Burmese population, Croatian. I mean, there are a lot of different groups here that come in. Besides, you have rednecks, which is its own group, and and you have, it's a giant college town also. So,
Yeah, and well, we've got, our population, really, we have very nice people that live here. But it's
super nice.
It's a great place to live and bring up your kids and all that sort of thing. But in all of this, we're not alone. I mean, if you look at 2/3 of the country is basically either overweight or obese. So it's like, while we take the prize, we have people nipping on our heels, like from West Virginia, Alabama, Mississippi, all that sort of thing. But
so it's mostly southern states.
Yeah, and they do in New Mexico. New Mexico's high in there too. So I was kind of shocked to see that one.
I believe Porco.
Well, evidently so. But you know what? It's one of those things. I looked at some numbers, and I thought these were pretty remarkable numbers that explain a lot of things. But it's like 1 is the best, 50 is the worst, and all of this. So if you look at it, so for diabetes, Kentucky ranks number 45.
Now, is that a scale of good to bad, or?
Let's just say 1 is great, 50 is the worst.
And is this a state by state, or just?
Yeah, what they did, this is all Kentucky.
This is all 50 state ranking?
Yeah.
Okay.
And this is all Kentucky, because what I want to try to do with this podcast, and normally what we always have like a national, if not international, flavor to what we want to do.
Right.
But I'd like to focus a little bit more on Kentucky and just to see if we can maybe right the ship a little bit. Maybe we can. But so diabetes, we're number 45. Cardiovascular disease, number 47.
Wow.
Chronic kidney disease, number 45. Frequent physical distress, number 48.
Wow.
Hypertension, number 44. High cholesterol, number 38. We actually got under 40. That's pretty good. Obesity, we're ranked 40th. Physical inactivity, we're ranked 42nd. Premature death, we're ranked 44th. And preventable hospitalization, we're number 47.
Wow.
So if you just look at all of that, it kind of shows you
when you rank in the 40s in the majority of those categories.
We're numero uno. So there we go. And what I found to be another topic of interest was that we ranked second in the number of fast food restaurants per capita. So we ranked second.
I think we used to be number one, but I think somebody's pulled ahead of us.
I mean, it's like, it seems to me like there's almost like a McDonald's within a McDonald's and a Wendy's within a Wendy's and a Taco Bell within a Taco Bell. It's just like, where are they not?
Yeah, because you don't really have a lot of, and not knocking the local businesses around here, you don't have a lot of really good, healthy choices when it comes to sit-down restaurants that aren't boxed or processed foods. And like you said, which are fast foods or, convenience foods.
Yeah, I don't think anybody can argue McDonald's, Wendy's, Taco Bell, they all fit that mold. It's fine. I mean, I'm all for free enterprise and capitalism, but on the other hand, I'm also for trying to take the best care of yourself you can and to indulge. I remember when I was a kid, I would go to McDonald's once a week. That was my treat. So that was it. But anymore, it's like, not like that anymore. Right? Would you agree?
Yeah.
This is not like that. Yeah. And the other thing too, I looked at these numbers, like diabetes cost us in the country, it's $327 billion annually. And cardiovascular disease is $422 billion annually. So much of this can just be prevented. That's the part. It's good news, bad news, because like we're just watching ourselves essentially become so out of shape, and with all these chronic diseases. But on the other hand, they can be prevented, and so we're all about that, preventing injury, preventing illness. We're trying our best to get people where we're not having these bad experiences, and live their lives in peace and harmony, not in the hospital. Because, entering our world is not a whole lot of fun. So we can get down to the Ozempic now, and what is a GLP-1 agonist, which is like a glucagon-like peptide. And some people say it's not even a drug, but I'm going to disagree with that, because it does things when you put it in your body. It does things, and that's what drugs do. They alter things. But again, it is naturally a peptide, which is just a string of amino acids. And so basically, when food hits, when you're eating and food hits the stomach, the whole digestive process begins, and there's receptors in the cells. All of this GLP is called a semaglutide, by the way. It's Ozempic, it's called a semaglutide. That's in the drug category of the GLP-1 agonist. And all of these receptors sit inside the intestine, and they do different things. They're hormones, and hormones target cells to perform certain tasks. And for example, like these GLP-1 receptors in the pancreas, well, they will increase the production of insulin and will decrease the production of glucagon. And insulin will lower blood sugar, and glucagon will raise blood sugar. Right. So that's in the pancreas. And in diabetes, there's very little insulin, or your body is not very sensitive to the insulin that you make. So therefore, you have high blood sugar. Ozempic will increase the sensitivity of insulin. So even what you make on your own, if it's not very much in an amount, or if it's injected, Ozempic will increase the sensitivity of insulin to make it work better. So that works. And in the stomach, you have receptors, and they will slow down gastric emptying. So that's going to make you feel fuller, longer, or increase satiety, and there comes the weight loss part. So I think the FDA approved this for diabetes like in 2017, right. And then it approved it for weight loss in 2021. So there's, it's been around for a while, but it just seems like it's just really taken off now. I think the sales were like at $21 billion last year.
Yes, it's insane.
Yeah, so it's pretty remarkable. And in the brain, it works in the hypothalamus to suppress hunger and cravings and that sort of thing. So these receptors are throughout the human body, which is, while they're saying like there's a lot of other undiscovered positive things about this drug that we don't know about yet. But these are the first two things that we're looking at. And the average weight reduction is around 15%, something like that, which when paired with diet and exercise. And if you look at that versus placebo, which was 2%, so it's statistically significant in that if you pair this drug with diet and exercise, you are going to lose the weight, and hopefully you'll be able to keep it off. But the weight reduction is pretty much equivalent to bariatric surgery. So,
that's where they get their stomach stapled or whatever.
There's all kinds of different variations
band things or
of
whatever.
That drug, of the operation. I mean, realistically, you have to get things straight with your own doctor, obviously. But if I can take a medication with hardly any kind of side effects and then pair it with diet and exercise, I would rather do that than surgery.
Right.
Because anything and everything can happen to you in surgery. Right. Even a very minor procedure, it's not minor if it's on you. And we've said that before. So when you get right down to it, this is a medication that just reduces inflammation. And inflammation is a vital component of any kind of disease process, whether it's diabetes, cardiovascular disease, inflammatory bowel disease, neurodegenerative diseases. All of it have a chronic inflammation.
All those.
Yes, and so if you can stop that, then that's obviously a huge component of this drug. But they're saying like at some point this may be involved in Alzheimer's disease, Parkinson's disease. So they're saying like there's a lot of data coming out that we don't even know about yet, and then the data is almost coming out daily in regards to this drug.
Yeah, because I would bet, and I may be wrong, and you would know that there's no long-term studies on the effects of Ozempic or any of these weight loss drugs.
No, I think that it just needs to be further out. I mean, some of the things, there was a thing about the drug possibly being associated with thyroid cancer, and that was in lab animals, not humans. So as far as thyroid cancer goes, that they were concerned about that at one time, but that is no longer on the table, it seems. So, but there is a condition called MEN, multiple endocrine neoplasias, and that's a very...
Yeah, I was just talking about that with my wife this morning.
I'm sure you are. Over coffee with the Dr. Frank and Steve mug.
That's right.
But for people who have MEN 1 or 2, I think specifically 2, it's one of those things you want to avoid Ozempic. But again, that's...
And what is that?
I've only seen that maybe 1 or 2 times in my life. Basically, it's a condition where you have multiple endocrine tumors, that sort of thing. So it can involve different organs, like, the thyroid, parathyroid, as well as pancreas, that sort of thing.
So all their numbers are out. Of all those things you have, stay away.
Yeah, so, but that's kind of where those studies are pointing. But you're right, though, as far as long-term data goes, we don't have a lot. And, the thing that concerns me a little bit, I understand the popularity of the drug, and why people want to do it. I get that. But on the other hand, it's like, it's so overwhelmingly popular.
Mm-hmm.
You know, what are we doing to ourselves long term with it? And we don't know that completely. But in the interim, I think that we can use it as a tool, and I'll go through that a little bit later. But one of the things too that we can look at is something called C-reactive protein, and that is a protein that's in response to inflammation. It's made in the liver, and you can measure that in the blood. And so people that have been on Ozempic, that have had type 2 diabetes and coronary or cardiovascular disease, their C-reactive protein numbers are coming down significantly. So that just shows you that the inflammatory response is decreased in all of this. So I feel that that's why they're saying this drug is so good for so many different diseases, is because it stops chronic inflammation, and because it will inhibit some of these pathways that are bad, if you will, for lack of better terms. But some of the side effects with the drug are nausea, vomiting, diarrhea, bloating, belching, flatulence, constipation, heartburn, fever, abdominal pain, and increased heart rate. Kind of makes you want to have an Ozempic party, doesn't it?
It's something to do with vision also, isn't it?
You know, there is, you know, I have glaucoma, and I'm kind of looking to see, like, does Ozempic have any kind of positive effect on glaucoma? I haven't really found that out yet, but they do say that if you have a diabetic retinopathy, to avoid Ozempic.
Which is?
Well, a lot of times diabetics have a disease in their eyes because it's diabetes is a disease of medium and small blood vessels. Mm-hmm. And so obviously you're gonna have small blood vessels in the eye. A lot of times those vessels are diseased, and that's why you see blindness in diabetics. And it will start with like a diabetic retinopathy. And so they're saying that Ozempic may have some sort of negative connotation in regards to that. So if you've got a diabetic retinopathy, it's one of those things you need to talk to your ophthalmologist about before you start Ozempic. And so that is another element that needs to be looked at. But I did, you know, I'm a huge Stones fan, as you know. But I'm just saying they've got their Ozempic theme song. But I'm thinking like Jumpin' Jack Flash, it's a gas, gas, gas.
So it's not the geriatric walking tour theme song.
No. You know, to me, this is the way I look at it. It's a tool to help people get started. I think number one, I do think it's bringing about an awareness that, I mean, everybody talks about it, but then they actually have something they can do that they can inject it, and then now let's start talking about diet and exercise, that sort of thing.
But do you believe a lot of them are like is it Ron Popeil? Just
Popeil.
Set it and forget it, stick it and forget it till the next week, and that's all they have to do.
No, I mean, you got to couple it with diet and exercise.
I mean, do you think there's a lot of people just do that?
I think there's a lot of people that think that.
Yes.
I think they're just kind of going like, oh, well, you know, hey, I've lost 20 pounds. But the issue with it is,
I'm heading to Bob Evans.
There's your biscuits and gravy.
Yeah, there you go.
But it's one of those things where you can lose fat, but you can also lose lean body muscle mass. So that's what you don't want.
Yeah, because that helps to burn the fat. Yes.
There's an epidemic, and each one of these things that we discuss, in a way, could be like a podcast on its own. But there's a condition called sarcopenic obesity, and I can't begin to tell you how many people in the United States have that. And basically, anytime sarcopenia is just loss of lean body muscle mass, and it starts around age 30, and you're going to lose a certain percentage of lean body muscle mass as you age. But you're seeing that now. I looked at these CAT scans, I looked at about 300 different CAT scans because that's how they're measuring a lot of this. And it's people who are classified as obese, and they're huge. But if you look at like what they're looking at is psoas major muscle that's deep inside the body, and they're looking at it, and where this should be just a huge muscle. It's just a huge muscle. And these people with what's called sarcopenic obesity, it's like little wisps of muscle. There's nothing there. And so it's just incredible. Like there was a guy, I got behind this guy at the grocery store, and he had to weigh like, at least 300 and some odd pounds. And he had like, I'm not gonna say which one, but he had like cases upon cases upon cases of soda and chips and all this kind of stuff. And there was so much soda on his cart. They just said, sir, do you need some help out to your car with that? And he said, no, I'm a big old boy. I can take care of it. But he was a perfect example. He had like on,
man's ear.
he had on he had on like this sleeveless shirt, and he's his arm, he's big, but he's just soft. He's soft there, and he's a perfect example of that. And that is such a danger, that kind of thing exists where because if you've got a lack of lean body muscle mass, especially as you age, that you and I've talked about this many times, that's cascade of doom. Because if you've got decreased muscle mass, you're more likely to fall. And then when you fall, you're more likely to break bones. And so it's like, and when you do break bones, it's usually like a hip fracture or a spine fracture.
Or like my poor father-in-law, who's almost 96, a double pelvic fracture that he had. He was in shape his whole life, and he got sedentary after he retired, and just, he's 6 foot tall and about 165 pounds, but he just didn't, he just didn't do anything, didn't exercise, didn't do anything really. Was still never very big, or isn't very big, rather, I should say. It just happened, he fell a couple times, and the one time he hit the sweet spot, and he only cracked that pelvic in one place, he cracked it in two, as you know. So that I would imagine somebody that those joints and everything, the more they weaken, the worse it is on you.
Yeah, and that's part of the thing about this Ozempic, where I believe it can be a major benefit, because like let's just say that you've got people that they're extremely obese, and they can't really get up to do much. And so if you take the Ozempic and then start losing weight to get some of the weight off of the joint space, so you can get up and move. So in that regard, I think it can be a really huge benefit, where people who are sedentary and they just don't do much of anything, this drug can help you get up, get moving. But to your point, and I think that's a point that just needs to be really hammered home, is that you can't just take the drug. You've got to combine it with cardio and
diet and exercise.
Yeah, and resistance training is an absolute must. I mean, I think you've got to lift weights
or use the bands
or something.
Yeah,
you've got to have resistance training, because if you don't, it just metabolically, it's going to.
Even free body exercises, push-ups, pull-ups,
anything,
all that. Yes,
you must do that. And one of the things I think with this drug that people need to think about is, if you look at the RDA, or the recommended daily allowance of different nutrients and that sort of thing, if you look at the macronutrient protein, if you look at protein, and a lot of these people, obviously, they will lose lean body muscle mass. And like the RDA is like 0.8 grams of protein per kilogram of body weight per day. Basically, you take your weight in pounds divided by 2.2, and that's your number of kilograms. So let's just say like you got a 200-pound person. And for that person, their RDA for protein is like, that's 90.7 kilograms. And you multiply that times 0.8, and that gives you 72.5 grams of protein per day
that they need.
That you need. But when you're on this drug, you may need 1 to 1.2 grams per kilo per day. So you need to potentially up that. But yeah, but again, that is, I cannot overstate this. Everybody is an individual, and you must talk about this with your own doctor and your own healthcare provider team, like nutritionists and that sort of thing. You can't trust us because we're not with you.
Right.
You know, we can guide you in a certain direction, but then it's up to you to get with your own team of healthcare providers and do it. So you're getting ready to say something.
No, I'm not.
No,
I'm done.
I know you. There was something there. There was some comment.
This is a family show, so we're going to keep it that way.
And now this one is an important one as well, of these tips. But on all the side effects, that we mentioned, nausea is the one that you pay the most attention to, because a lot of people will take the drug. They'll take a dose of the drug, and then they get nauseated, and then that will proceed to vomiting and that sort of thing, and they'll stay on that same dose. And what you need to do is that dose needs to be backed off. If you're experiencing nausea, then that dose needs to be backed off, and that's usually
tapered.
Yes, and you need to take it back, because you can dial it back in increments of like 0.25. You can dial it back. And so, but if you're getting nauseated, you just need to take the smaller dose and then work yourself up eventually to what the doctor feels should be your maximum dose, and see where you are.
And I would imagine most doctors would happily, make sure that's what's working for you, tapering it up or tapering it off if you're coming from whichever.
Yeah, and there's some people that are saying like, well, I'm on the drug and I really didn't receive any kind of instructions or anything like that. I'm just like, well, you're on your own. And so it's like, for that, this kind of program can help you, because if you're experiencing nausea, you need to let your doctor know and say like,
Well, so many things are available now. I mean, that's one of the reasons why the craze has gone wild, is because you've got, again, not nurse practitioners or physician's assistants, but every commercial on TV, and I don't even watch that much TV, is Ozempic, or whatever it might be, we need your cachet, whatever the weight loss drug is, or, for diabetics, you can go online. You don't even have to have a family doctor. You can go online, do a little consultation. They'll prescribe it. Either they will prescribe it, get your insurance information, or you buy it, ship it to you, or they'll get your prescription for your local pharmacy. And I think that's what's helped fuel this craze so much, because everything's so accessible, whether people believe they need it or not. And then they hear that the Hollywood stars are doing it, and so they think that that's an easy way. If it works for them, it must work for them. So getting back to that and looking at that, one question I did have was, this is not good for somebody with type 1 diabetes, correct?
I think it's still kind of being discussed.
Okay.
I think type 1 is another animal.
Right.
That's just another animal. I mean, usually, that in somebody younger, and type 2 is more of an environmental kind of thing, of not dieting, not exercising.
Well, yeah, because I've had several students and one that has type 1 diabetes, and they're probably, they're skinny as you could be. Sometimes I'm tall, skinny, but they're type 1 diabetic, and that's different than, like you said, somebody like the gentleman at the grocery store getting his soda pop.
Oh yeah. And the other thing too is, like, if you're getting your Ozempic from like the stem cell bait and tackle shop, that's a red flag.
Well, I believe, because I was listening to a streaming service, which was they do a lot of different newscasts, but they had a couple of doctors on there, MDs, who were talking about just be very careful. They're not knocking it, as we're not, but if you do things online, you need to make sure you're researching who, if they're going to ship the product to you, you need to make sure, because they're saying that there's a lot of sodium-based like fillers and all this being put into these things that are not actually 100. And again, we're not saying this, it's just a warning to be cautious. They're sending out products that are not technically 100% what you think you're getting.
And my wife's a pharmacist, and she gave me a point that addresses that, and we'll go over it. But this was in the Journal of the American Medical Association yesterday. Okay. So you talk about current.
And that's a big organization.
I'm just saying we're current.
Yeah.
We are current.
That's right.
Yeah. But this is something that happened that is just reported yesterday. And so with breaking news. Breaking news. Okay. It's when you are taking your Ozempic and you're losing weight, and you're taking another drug that's based on your weight, that drug
needs to be changed.
Needs to be modified to the old dose is no longer
valid,
really going to help you and can hurt you. And that's what happened here. Is there was a patient who was on Ozempic who actually was a thyroid patient, and was, they were taking thyroid medications and thyroid supplementation. And what they did, they lost all this weight, and then they kept the same dose of the thyroid medication
based on the weight that they were.
Right. And then like all of a sudden they end up in the emergency room with thyroid toxicosis, increased heart rate, atrial fibrillation, all those sort of things. So you really have to watch it, because and I just thought, like, it's such a commonsensical point, but
who would catch that?
You
weigh 200 pounds, you get on Ozempic, but you're on 4 or 5 other medications that are based off that 200 pound, or obese spectrum for that condition. And then you get down to 170 pounds, 100 whatever. That, like you said, you could be overdosing yourself without thinking about it. And how many physicians, because they're just prescribing your refills on these type of medicines, I would believe would say, everything's still good. And unless they really realize that and analyze, that's why you gotta have good doctors and RDs, real doctors, so that they know that, or you should bring that to the attention of your family physician or your doctor.
Yeah, and it's very true what you say. Is like the doctor, he or she may be seeing 35, 40 patients a day, which is just really, it's overwhelming.
And to clarify, for legal purposes, Steve did say he or she, because we believe there's only 2 genders. Go ahead.
There you go. Yeah, that's plenty for me. But the point is like, again, you have to be your own advocate here. If you say, like, if I'm taking this drug and now I'm 30 pounds lighter than what I was, do I need to make adjustments in my other medications? And the answer is a lot of times yes. Sometimes no, but a lot of times yes. And if you don't, I mean, like that person that, could have been like in thyroid crisis kind of thing, which could be life-threatening. So it's one of those things where you really have to pay attention to that. And they're just now, again, that was just fresh out of the medical literature. So I don't think
that's an excellent point. No, I would have never thought that's 100% spot on.
Yeah. And the other thing too, that this is what Mary Lee, my wife, told me about, was like, you've got I think it's Novo Nordisk makes Ozempic, the brand name, something like that. But it's one of those things where if the demand is so great, then they are compounding this drug. And individual pharmacies are compounding the drug.
And making the drug themselves.
They're making the drug
themselves. Because I heard that there's a shortage sometimes. What I've read this morning and some yesterday on a couple articles, where the demand, and there's such a shortage that, as I'm going back to, and I know you're going to cover this point, but that some of these online places are actually not making it to the actual criteria that's supposed to be made at.
Right. And
to get it out there.
Right. And well, I mean, when you get to that point, it's just all about the money. I mean, that's all there is to it. But we got to think past that when we're talking about morals and ethicals and professionalism of the whole healthcare practice.
Right.
But if you get the drug in compounded form, this is another thing that I don't think that people are talking about. But we advise that if you're going to get the drug in a compounded form, you get it from a pharmacy that has this high quality certification, which is denoted as PCAB. It has to be a PCAB accredited pharmacy, which means a Pharmacy Compounding Accreditation Board. So if you're going to get the drug compounded, you get it from a pharmacy that's got a PCAB designation.
So if it's the 7-Eleven with the Joe's Crab Shack, bake shop, and pharmacy, you might want to check that.
I would do that. Yeah, it's just like I'm going to say probably if you can buy a lottery ticket there, don't buy the drugs from there.
Yeah. Don't get your Ozempic or your Wegovy or whatever the drug is.
Yeah, I mean, it's like you get a pack of smokes, 6-pack of beer, Ozempic, and a Lotto, and you're set. So that's another thing. But I'm near the end of this conversation, but I do want to say this, is, if you can stay away from taking any drug, it's so much better. I mean, I just try my best to tell people, look, it's so much easier to prevent disease than it is to treat it. It's so much easier with all these complications that can happen and all of these things that we're talking about. I mean, you're not going to have drug side effects. You're not going to have to be worried about, does the drug do this or does the drug do that, if you don't need the drug.
Right.
So don't need the drug.
And as a foreign adversary once said, and you can pull it up on China's website, their own commercials, they're not going to have to fire a shot if they ever want us. We will actually, medically and health-wise, we'll be our own demise as a country because of things like this and because of the epidemic of obesity and and unhealthy lifestyles.
Well, I mean, you're looking at, realistically, I mean, I haven't seen the exact figure on it yet, but just looking at diabetes being 320 some odd billion, cardiovascular disease being 422 billion. So you're almost approaching $1 trillion on diabetes and cardiovascular disease. So just look at what you could do if we didn't have that. And so much of that is just totally preventable.
Right.
But a lot of people too have been saying, like, when they get on Ozempic, I mean, when we go to restaurants, I mean, a lot of times the portions are just absolutely huge.
Yes.
And so a lot of people on the Ozempic are saying, like, I no longer can eat, what's on the plate in front of me now. I have to, it's like I'm full. It is working. It's making me feel full sooner rather than later, so I'm eating less. But that's the thing. And I think that people say, is it a lifetime drug? Well, you get to a max kind of like, okay, I'm at a max dose here, and then I'm at a good weight, and I've got as far as lean body muscle mass versus fat and all that sort of thing, I'm really metabolically sound right now. And so then you can start tapering the dose. But what you're hoping for is that when the dose is tapered, yes, some people are still gaining the weight back, but they're eating less. And now, hopefully, they are also exercising in the way of cardio as well as resistance. Yes, so it's like, they've seen the light, if you will. And so it's like, and if Ozempic does that, if it just, bringing about awareness is a big thing. And bringing about awareness with a point of action is just like, okay.
This shouldn't be your long-term, lifelong goal. No. Because there are people in their, late teens, 20s that are getting on these drugs. Yeah. And to say I'm going to be on that drug for 50 years, or 60 or 70, that's a long time.
Oh yeah, and you don't know what the long-term effects are.
No, you don't.
So, and that's another thing too on kids that people ask me about this and kids, and there's different philosophies on that. I think I've seen where like maybe somebody's older than 12 or something like that, but I don't want to get into that because there's a big reason I did not get into pediatrics. I just said just no way. So I'm not going to touch that with a 10-foot pole.
Because it has everything to do with patients, and we're not talking about your clients.
No, I mean, the only thing that was, to me, that was good about pediatric surgery, you had to do pediatrics in med school and everything. I had to do pediatric surgery when I was a surgery resident. And the only good thing about operating on kids was the fact that they did not have like 30 or 40 years of smoking, drinking, and overeating. It's just like, so they, you didn't have a lot of complications with kids that you did with adults, but still, I would rather just take my shot on adults any day of the week. But so when it comes to kids and Ozempic, ask your doctor about that one. And what we've tried to do here is just give you a good broad overview of the drug and what it can do. And there's going to be already new generations of the drug. There's going to be variations in new generations of the drug. This is like a GLP-1 agonist. There are also going to be drugs with adding what's called GIP. So there's already new generations of this plus. So we're just now kind of starting to see the very beginnings of all this.
Of what's going to be $1 trillion, if not already, industry.
Oh, I would think so. Because I think it's at this stage right now. I listened to a webinar by a physician that's been involved in some of this from the beginning, and he said that 1 in 8 Americans are on this drug right now. Wow, that's pretty impressive.
Yeah,
that's pretty impressive. And
that's kind of you'd want to have stock in from the beginning.
It would be, wouldn't it? Yeah, it would be. So that's all I got for this one.
No, we're good. I think we covered this pretty well, and we want to thank you all. And like I said, we do a mirrored area of topics as far as health, art, self-defense, you name it, financial, mental, especially since both of us kind of mental. So we appreciate you folks being here. And until next time, you stay safe and stay healthy.
And remember, BGKY, number 1.
That's it.
Thanks for listening to the Dr. Frank and Steve podcast. If you enjoyed this podcast, please hit follow or subscribe on the link provided so you can stay up to date on new episodes. Until next time, stay healthy and stay safe.